1. Made in India leprosy vaccine to be launched. GS Paper 2, Issues related to health and human resources. What is the context about? A first-of-its-kind leprosy vaccine developed in India is to be launched on a pilot basis in 5 districts in Bihar and Gujarat. If it shows good results, the vaccine program will be extended to other high-prevalence districts in the country. Points to be noted. The leprosy disease, caused by the bacteria, Mycobacterium leprae, affects around 1.25 lakh people every year in India. That is 60% of the world's leprosy patients live in India. How prevalent is leprosy in India? In 2000, the World Health Organization, WHO, had declared that leprosy was eliminated globally, with the disease prevalence rate dropping to below 1 per 10,000 population. India tops the list of countries fighting the stigma of leprosy, even after 15 years of the disease being effectively eradicated globally. Of around 214,000 new leprosy cases reported every year globally, India accounts for around 60% or more than half of the new incidences, latest assessments show. India, Brazil and Indonesia together account for 81% of the newly diagnosed and reported cases globally. Efforts at eradicating leprosy. WHO has now come up with a new global strategy, calling for stronger commitments and accelerated efforts by governments to stop disease transmission and end associated discrimination and stigma. The new strategy, with a 2020 deadline, is to reduce the number of children diagnosed with leprosy and related physical deformities to 0. Reduce the rate of newly diagnosed leprosy patients with visible deformities to less than 1 per million, and ensure that all legislation that allows for discrimination on the basis of leprosy is overturned. According to the WHO, the key interventions needed to achieve the targets include detecting cases early before visible disabilities occur, with a special focus on children as a way to reduce disabilities and reduce transmission. Targeting detection among higher risk groups through campaigns in highly endemic areas or communities, and improving healthcare coverage and access for marginalized population. The new strategy builds on the success of previous leprosy control strategies. It has been developed in consultation with national leprosy programs, technical agencies and NGOs, as well as patients and communities affected by leprosy. The strategy focuses on equity and universal health coverage, which will contribute to reaching sustainable development goals on health. Challenges in eliminating leprosy. According to the health data, the main and continuing challenges to leprosy control are the delay in detection of new patients and persisting discrimination against people affected by leprosy. Though all countries have achieved the disease prevalence rate dropping to below 1 per 10,000 population at the national level, at the sub-national level, it remains an unfinished agenda. About the vaccine Mycobacterium indicus pranii, MIP. The vaccine, Mycobacterium indicus pranii, MIP, will be administered as a preventive measure to people living in close contact with those infected and could bring down cases by 60% in 3 years. It was developed by the National Institute of Immunology, New Delhi, and has been approved by the Drug Controller General of India and the FDA in the US. The first exclusive vaccine for leprosy, made in India, will be piloted in 5 districts of Bihar and Gujarat in a few weeks as a part of the country's efforts at eradicating the crippling disease.